Thank you very much, and good afternoon, good morning to everybody, and thanks to FAO for this opportunity. We've been asked to talk a little bit about vaccines and vaccine strategy to reduce antibiotic consumption. And when talking about this, we also acknowledge the huge diversity of this industry that sort of is quite challenging on all these aspects. Let me see. And we all agree, I think, that antibiotic is quite essential remedy in all medicine, including aquaculture, to fight bacterial infectious diseases. And because of its preciousness, it's also very important to use it in a proper way. Can keep this potential that the antibiotic has. As we see from this table, the consumption varies quite a lot between countries, and although these numbers are from 2000, they still give some indication that there is a huge variety between countries in our use of antibiotics. This may have a lot of various explanation. You can say the species cultures, the various diseases the countries are struggling with, governance, national regulations existing of these, technical services given to the farmers, and of course available vaccines. Most of these are nevertheless embedded in what we could call a biosecurity concept, and looking at the various causes for this variation, we can also see there is a huge potential to reduce the global use of antibiotics. Vaccines are regarded as an integrated and central part of biosecurity. We have so far what we could call first and second generation vaccines that has been used with great success, maybe especially in fish production, and they consist of attenuated or inactivated agents, including adjuvants. There are so far less efficient vaccines for viral diseases. In the Norwegian aquaculture, I could say that we've been using vaccines against several bacterial diseases for the last 30 years with great success. And so far we have what we call a multivalent vaccine that contains of 6, 7, or 8 various antigens in the vaccines. And they have been very efficient for our production. And annually, we actually vaccinate around 350 million smolts that are put to sea. However, it's also important to state that the vaccine do not work efficiently alone. Other biosecurity measures need to be implemented as well. Measures that will help to reduce the total infectious load and to secure an optimal environment and efficient innate immune response. We can see from our situation with the pandemic that exists today that while we're all waiting for the vaccine, we clean our hands, we wash our hands thoroughly, and we keep social distancing. Some of these measures, biosecurity measures that we do today, will definitely exist after a vaccine arrives. A vaccine also has a long-lasting effect, which we cannot say for an antibiotic. It curtails disease when it's given, and after that, the effect is over. So every time we have a problem, we need to give the fish, the population, a new dose of antibiotics. This has negative impact on the agents, as we've heard, but also on the environment. So in that sense, we can say the use of antibiotics, at least when not prudent used, is not a sustainable way of aquaculture or keeping control on bacterial diseases. It's also worth emphasizing that antibiotics do not work against viral diseases. So, why do we don't have more vaccines available? I could say that for the vaccine industry to see aquaculture as a profitable market, we need a stronger interest and commitment among all stakeholders. This includes, not the least, governments to encourage the use of vaccines. We need research on developing good vaccines. We need farmers to be interested in using the vaccines. And of course, the vaccine industry itself need to see a potential for earning money as they need. The use of vaccines needs therefore to be encouraged. There needs to be a demand. It needs to be easy, accessible for testing in the field, so it's not too complicated to develop and move forward to get an efficient vaccines. And it needs to be efficient. It needs to be proven efficient for the users. And of course, it also needs to be efficient for the exact stage of the fish that requires these vaccines. Appropriate methods to immunize animals are needed, taking into account the very diverse industry with variation in animals, age, production forms, etc. I have a problem. Yeah. Right. Challenge in the delivery system. The usual way has been immersion, which is a soft or gentle way of immunizing fish. It's not that efficient, definitely, for the first and second generation vaccines. Injections, which are used mostly in Norway, it has its practical issues. It's automized a lot, but it's also gives some adverse side effects. Oral vaccines is a very gentle way of doing it, but to apply oral vaccines today is difficult due to less efficient immune response in the animals. We also have challenges on costs, and developing vaccines are quite costly. So we need to see how the vaccine actually benefit the disease situation. There's a surprisingly lack of cost-benefit analysis in the industry, and this sort of knowledge, the efficiency of vaccines in the long term compared to other ways of controlling disease, is a huge lack as I say, in the industry, and needs to be encouraged. The way forward is basically to try to implement biosecurity measures, including vaccines, to encourage this as an essential part of health management standards, and to see this as a sustainable way of producing fish. We need to, of course, also acknowledge the use of antibiotics, but there needs to be prudent use. There needs to be standards how to use it. It's been talking about microbiota. We see that the knowledge gaining today on microbiota, both on mucus and in the gut, is important to see how the vaccine can, or the general resistance, innate immunity in the fish is related to the microbiota, but also how microbiota can help picking up the vaccine, especially when giving in the oral way. We need to improve knowledge on cost. That is one of the best way to encourage the vaccine use. Vaccine in the long term, or more beneficially in a costly way than treating with antibiotics. We see a huge potential now in the third generation vaccines, especially the DNA vaccines that are developed now more and more. All this puts our efforts into being more proactive, so we can see that the disease, the cost of the disease is best handled if we can prevent disease, as been mentioned by all the speakers earlier today. So in this curve, I tried to say that we need to move toward the left of this curve in order to reduce disease occurrence, and also show that this is the best way in an economic and sustainable way. Thank you.